One of my major research interests focused on disease detection, such as finding some specific biomarkers for diagnosing a variety of diseases. And laboratory diagnosis is also one of my tasks, no matter on lecture teaching or assisting our animal hospital working. So I'm glad to be with you together tonight discussing the following topic. Today, we are looking into the diagnosis of the blood parasites or bacteria in dogs. And later, we will introduce the three major blood diseases, including heartworm, Eliquiosis, and Parasites, will be reviewed tonight. Okay, so the dogs are frequently suffered from mosquito or tick biting, just like what we are. However, these insect vectors can spread parasites, protozoans, or bacteria among dogs, and some of them even zoonosis. It means the human could also get infected if we are also bitten by these insects carrying the pathogens. So we will introduce these 6 significant blood pathogens transmitted by mosquitoes or ticks to result in big healthy problems in dogs. So heartworms, Ehrlichia, and Babesia will be introduced later. So let's begin with the heartworm first. How heartworm can cause the life threats to dogs? As I think it's a series of story. If the mosquito bite and infected dogs, it will take tiny baby heartworm. We can also say the larva. It will take tiny larva along with the animal's blood. And then this larva will develop their growing life cycle in the mosquito. I think I try to find some pointer here. I'm sorry, I try to find some pointer to please wait for a moment. Okay. So we are just here. We just mentioned about that if the mosquito bites some infected dog, it will take the tiny larva, and this larva will survive within the mosquito, and then develop their growing life cycle, and finally become infective staging inside the mosquito. So when the same mosquito bite another healthy dog, and the larva will swim to this dog to infect he or she. And this larva, when these larvae are entered the healthy dogs, it will first exist in the subcutaneous tissue, then slowly migrate to the muscle deep and deep. After around 4 months, they become adult worms. Then they will migrate to finally the goal they want to arrive is pulmonary artery and the heart. So finally, the adult heartworm will live in the pulmonary artery and the right side of the heart. So we just talked about in the previous slide that this larva or microfilaria, when they into the infected dog, firstly, it was in the subcutaneous tissue, then they migrate to the muscle, and finally they can invade into the blood vessel and finally arrived at the pulmonary artery on the right side of the heart. And then it may be they need at least 6 months to become mature one. So if they successfully to live within the right side of the heart or pulmonary artery, and if they got enough male and the female adult worms, they can mate and generate their babies. And that means after 6 months, there are many microfilaria will be produced by these adult worms, and this microfilaria will again circulate within the dogs, within the bloods. Okay. So we just mentioned about this, the life cycle about the heartworm infection. The one thing we need to know is this kind of heartworm, we also, the formal name of heartworm is Filaria immitis, and heartworm can not only infect the dogs, actually infect a lot of animals. It can also affect cats or coyotes and even human. But they may show different clinical symptoms. So while a mosquito is feeding on the blood of an infected animal with advanced stages of diseases, it will ingest the baby worms, or we so-called microfilaria, and this microfilaria can get into the infected animal's blood. And about 2 weeks, these baby worms will reach a level of maturity and becomes infectious. So once the mosquito bites a susceptible host, it means this susceptible host, that can be dogs, can be cats, can be human. It transmits the infectious larva onto the skin of the animal, and the larva then makes its way into the puncture wound left from the mosquito's bites, and then it will migrate from the wound to the muscle, and then the really place, the very good place they want to achieve is the blood vessel, is the pulmonary artery, and then the right side of the heart. So the severity of the heartworm infection will result in different symptoms we observed in our dog friends. And because a heartworm can live up to 7 years, so the symptoms are dependent on the stage of infection and the number of worms an animal has. So the number of worms is a very interesting issue. Just as I mentioned, not every infection can become so severe as I described in previous slides, such as a lot of dog worm present in the pulmonary artery or the heart. That is because it's random, because if the dog is bitten by the mosquito, so some microfilaria will enter this dog. So how many microfilaria enter? We don't know. And if the microfilaria are male or female, we don't know. So there are some rare cases. Maybe these microfilaria are all male or are all females. So in these cases, there won't be any baby generated, right? So the number will be not will not be the large number within an animal. So the stage of infection and the number of worms will decide the outcome of the animal infected by heartworm. So basically, we can classify the disease severity into 4 stages based on the symptoms we found. So in stage 1, actually, maybe we cannot see any symptom present. Or maybe sometimes in very rare cases, we found, or the owner found that their dog is coughing. So it's stage 1 with almost no symptom. In stage 2, we can find occasional cough or the dog become exercise intolerant. So this is stage 2. It means that some Microfilaria or some larvae become a worm, and they start to enter the blood vessel to leave the pulmonary artery. Okay, and in stage 3, more and more adult worms are there. Okay, in the pulmonary artery. So we can find the cough, the exercise intolerance, the frequency of cough and the exercise intolerance increases, and the labored breathing is found. So we can also find signs of heart or lung damage when you perform the chest radiography. You can find the maybe enlarged heart or some lung damage in the X-ray film. And the most severe stage is stage 4, when the dogs are in stage 4 infection. The heartworm have caused severe damage to the animal's heart, lungs, liver, and kidneys. In this stage, heart failure with or without the Kavol syndrome is likely. And Kavol syndrome is when there is a large burden of worms, a lot of worms, blood flow in the right side of the heart. It creates a certain life-threatening problem in need of quick surgical intervention. However, at this point, most dogs do not live long enough to receive the life-saving surgery because it will happen suddenly. So it's a very not good situation for the dog if they are in stage 4. So in some severe cases, we don't need to do any concentration step. We can only take a little blood to perform the blood smear. Then we can easily detect the Microfilaria, I mean the baby heartworm, in the blood smear. And when this Microfilaria become adult, the adult worms, they will migrate to the heart and the pulmonary arteries. So finally, you can see this is the adult worm. Okay, they are large enough to be seen by your eyes. And when they stuck here, it will result in Kavol syndrome. So how do we diagnose the heartworm infection? And I think the guideline will be the earlier it is detected, the better the chances the pet will recover. So how to carefully observe the healthy condition of the dogs by the owners or by the veterinarian is very important. So if you want to diagnose the heartworm infection, we may need to know the history of the animal, and we need to do some physical findings. And this symptoms or clinical signs will help us to give some differential diagnosis. And heartworm is maybe one of the item in the diagnostic list. Also, we can perform the chest radiography or echocardiography and use these image techniques to help us to find the abnormal signs of the heart and the lungs. For example, this is the ultrasound image in the dog suffered from heartworm infection, and we can see here, and as well as here, you can see the parallel white line. And this is the adult heartworm. And the white line is the cuticle of the heartworm. Cuticle basically is the keratin-based structure and cover the surface of the heartworm. So when you perform the ultrasound, if it's the heartworm infection cases, finally you can find many parallel white line, and actually it's the adult heartworm within the heart. Okay. So we can use and we can observe the symptom. We can use the X-ray or ultrasound to help us. And I think we can basically we usually use blood smear or serological tests in the lab diagnostic. We usually use these ways to help us confirm our suspect of heartworm infection. So we have a different kind of test. We have tested for adult worms, and we also have tested for microfilaria. So let's start from the adult worm test. And the American Heartworm Society recommends using the heartworm antigen test as the primary method of testing for adult heartworm infection. The important thing we need to know is the test is specific for adult female heartworm. Antigens detectable by over 1.5 to 6 months after infection, and the positive results may be obtained with the few as 1 to 3 adult females in the heart. So it is a very sensitive test. While the important thing we need to know is this test is for adult female heartworms. And another thing we need to know is this test as detect the antigen, I mean the heartworm, and the time is important, I mean. And this test is only effective after 6.5 to 7 months after infection, because the worm need to take around 7 months to become mature from the baby larva to adult worms. So, and currently, actually, we have so many commercial product options for us to do the adult worm antigen test. So such as the BioGuard company, they also have the products for us to detect the adult heartworm presence, if any adult heartworm in the blood. And another issue I think it is important to be mentioned here is the antigen test. Maybe the result of the antigen test may be false negative. So if we got the negative result, we need to but you are still highly suspect that this is the heartworm infection case, I think the following points maybe can give you some idea to rule out if the result is truly positive or false positive. So that's beginning with the first point as the infection. If the infection has been present for less than 5 months, okay, so we just mentioned at this point in the previous slide that because the larva to become the adult worm, it will take around 6 months. So if the infection is less than 5 months, we don't have adult worm, or we don't have enough adult worm to be detected by our antigen tests. So if so, I think the possible solution for this consideration is maybe we need to tell the owner that another test may be needed, maybe after 2 or 3 months, and then we can to make sure if the antigen test is truly negative or false negative. And there are rare cases I just mentioned is maybe the worm are all male or all immature female. Because the antigen test is designed for a mature female, so if the worms are all male, the result will be negative. Or if the female are immature, the result will be also negative. And the other possible is the very low numbers of worms, because I think any test will have the will have the detection limit. So if the case did not have, they have very low numbers of worms, it cannot be detected by the test. So and the final point is if you still highly suspect the case, maybe you can use different commercial product to confirm your results. So if we got the false negative result, we need to consider if it is true or false. So we just talked about the test for adult heartworm. So now we are going to the test for microfilaria. Actually, any antigen test that is positive or weak positive should be followed up with a test of microfilaria. Okay. It is important because the antigen test, what we did is to detect the antigen, the heartworm, in the blood by a kit. But if you can see the microfilaria by your eye, it can confirm your diagnosis. So how can we observe the microfilaria? I think the best way we used, we will try to concentrate. So what we called concentration tests. So the preferred test is the modified NAS test, which involves using a centrifuge. And this is a machine to concentrate your sample, to concentrate your blood, concentrate the microfilaria together. And then you can, to help us easier to find the baby larva. And another common test to put the microfilaria together is the filter test. And the filter test by using the filter test, it will passing the sample through a very fine filter that traps the microfilaria together. So whether NAS test you use or you use filter test, you can concentrate, you can put the microfilaria together, and then you can do the blood smear. Then you just using the light microscope, and then you may find the microfilaria within the blood. And if it is a severe case, just as I showed in the previous slide, maybe you don't even need such concentration or filter test. You can just take a blood and under the light microscope, then you can find a baby worm. We say hello from the slide. So that's the microfilaria test. Again, this test may also give you the falsely negative result. And the reason may include, for example, none of the adult worms are mature enough to mate and produce microfilaria. So it again is about the infection duration. If the infection is less than 5 months, is less than 6 months, okay. So this larvae, they are not mature, so they cannot mate to produce their babies. Or in some rare cases, so the adult worms are of one sex, so they cannot mate. Also, too few microfilaria. Even you use some concentration methods, if it's in stage 1 infection cases, maybe you cannot find some microfilaria in your blood smear. So but maybe you have found some symptoms in the dogs. So continually monitor the development of the symptoms, the clinical signs, or just repeat the test in 1 or 2 months again. Maybe will clarify your suspicion or to confirm your findings. Okay, so the just as I mentioned before, the heartworm not only infect dog, it will also infect different species such as cats or humans. So this heartworm is spread not intraspecies transmission. It can also perform interspecies transmission. So we need to keep in mind that it is important. If we have many animals if the owner has many pets within one house, so the heartworm prevention will need to be administered in all animals in the house. Okay, so we just mentioned about the heartworm infection and the clinical signs, and the most important is we introduce how to diagnose the heartworm infection. We can use clinical sign, we can use some X-ray or ultrasound, but I think the serological test, the blood smear, will help us to finally confirm our diagnosis. So the second blood bacteria Eliquiosis is a kind of bacteria infection, and it is caused by Rickettsia. Okay, it's a very small size of bacteria. Leukiosis is also an insect-caused infection, and this kind we are mentioned about tick. So leukiosis is a tick-borne infectious disease of dogs, and usually carried by the brown dog tick. The organism responsible for this disease is a rickettsial organism. I just said the rickettsia is the smaller size of actually bacteria is a big family. There are so many species of bacteria, and the rickettsia is one kind of bacteria with the small size. Okay, and the Eliquiosis in dogs is caused by Eliquia canis, and it is the most common rickettsia species involved in Eliquiosis in dogs. But sometimes other Eliquia can also cause the Eliquiosis in dog. The disease seems to be particularly severe in some dog species, such as German Shepherd dogs or Doberman Pinschers. So let's see the Leukiosis, as I just mentioned, it is transmitted by the tick. So there will be a disease named by tick fever, and tick fever usually is to describe the general. It's a general name given to a group of diseases, including Leukiosis, and these diseases are all caused by the tick bite. So we can find that they transmit the life cycle, the tick life cycle in the brown, especially we are focused on brown dog tick because there are so many tick species. Okay, so firstly, we focused on brown dog tick. The brown dog tick life cycle is about just like the start from host one. Host one, it will got larva stage and lymph stage, and when in lymph stage, they can go to the host 2 and to become adult. They become adult, they will infect host 3, and the adult one can be made and to lay eggs, and these eggs can spread everywhere in the environment where the dogs live in. So if the eggs are hatched, they will go to infect another host. So it's the typical life cycle of a brown dog tick. So when we talk about Leukiosis, actually it is mainly tick. It's mainly live within the brown dog tick. So we can see the different stage of brown dog tick. It's the larva stage, it's the lymph stage, and adult male and adult female tick. Now we can see the different appearance of the different stages or sexuality of the tick. And this is another tick we call the American dog tick. Last slide talk about the brown dog tick, and this slide we describe about the American dog tick. And when we carefully observe the appearance, we can see the difference ticks. So again, it's the larva phase, lymph phase, adult male and adult female. So from last slide to this slide, we can see the tick seems maybe they looks thin, looks not very big. But okay, I think the but is very important. Okay, it's the female adult American dog tick. Is unfed by the blood. Is unfed stage. When they just bite, okay, attach or bite the host. So it's the unfed tick. Then after days, when they try to to suck the blood, suck the body fluid of the host, then it can become so large. So I think it is very interesting that the tick has very great flexibility on depends on how many blood fluid they sucks in. And during the biting and during they live in the host, they can transmit so many diseases among the dogs, such as Leukiosis, or such as Babesia, or such as Lyme disease. Okay, so this unfat tick, this fat tick, you can see the body size varies, very differences. Okay, so you can, these two pictures shows us why we usually found the tick on the dog. So if you just if you just to see to sort the wool, to sort the fat, you can see they just attach the skin to bite on the skin. And this is the smaller one, maybe unfat one, and this is the bigger tick because it just anchored on the skin of the dog and try to suck the body fluid of the dogs. So you can see the variable body size of the tick. I think all of the doctors here, you've already know, and if we found that this situation, we can not just pull the tick directly. Okay, we need to bring the dogs in the clinics to do the proper management. So this tick bite is not a good thing. Actually, it is very bad, and we need to take care this issue very seriously, because I just mentioned that the tick will transmit a lot of diseases. And the first one we want to introduce is about Eliquiosis. When accompanied with the tick biting, Eliquia, this bacteria will infected to the host. And we can also, according to the clinical side, we can also divide the Eliquiosis into 3 stages. And the first one is acute, or so-called early disease stage. In areas where Leukiosis is common, many dogs are seen during the acute phase. And the infected dogs may have fever, swollen lymph node, respiratory distress, weight loss, bleeding disorder, and sometimes accompanied by neurological disturbance. Because this rickettsia will, when they go into the blood, they may finally to the brain region and to develop meningitis. And this stage may last 2 to 4 weeks. And some dogs may eliminate the infection or head into the subclinical phase. So it is a very annoying situation. Some cases, they can be treated well, treated to make the dogs back to healthy status. But there are always some cases to go to the subclinical phase. So what is subclinical stage of subclinical phases? It means we cannot see any obvious signs of diseases, and the stage of infection in which the organism is present, the Eliquia is present, but not causing any outward signs of the disease. These dogs may become subclinical and develop changes observed at the laboratory level. It means if you perform any blood test, you can see any abnormal findings. Of course, you cannot find any apparent signs of illness. And the subclinical phase is often considered the worst phase because there are no clinical signs. So most of the owners will consider that their dogs are healthy. Actually, it's not, because the bacteria are just the bacteria just hide somewhere within the body, and they just wait for a proper situation to burst into bad infection. So the only hint that the dog may be infected during this phase may be after a blood sample is drawn, when the dog shows prolonged bleeding from the puncture site. So it is the only sign we can suspect that the dog may be in subclinical phase of the Ehrlichia infection. If the dog is hurted, if the dog is being drawn the blood, and we found the dog has the prolonged bleeding time, then plus we know that the dog has the acute Ehrlichia infection history before, then we need to keep in mind that maybe the Ehrlichia is not did not leave the dog, they just hide. So another phase, another phase is about the chronic or long-standing infection. The chronic or clinical Leukiosis occurs because of the immune system is not able to eliminate the organism. That is what we call the proper time for the bacteria to burst. Most of the time, if in the subclinical phase, the bacteria just hide. But we have the intact immune system. So even the bacteria, sometimes they will hang out within the host body. The intact immune system will destroy this bacteria. But unfortunately, if in the case the immune system has some gap, has some defect, and this Ehrlichia it will get the best opportunity to attack the host. So in this clinical Leukiosis, dogs are likely to develop a host of problems, including there will be many. They will manifest many typical syndrome like anemia, like bleeding episode, lameness, eye problems, and these eye problems including hemorrhage into the eyes, and maybe the most bad situation will be blindness. And also you can find the neurological problems like meningitis and the swollen limbs. If the bone marrow fails, and the dogs becomes unable to manufacture any of the blood cells necessary to sustain lives. Okay. Actually, the Ehrlichia, because it's a small size bacteria, so they need to live within the host cell, and host cell, the Ehrlichia will live. Basically, it's monocytes. So if the Ehrlichia live not only within the monocyte, but also in the bone marrow cells, it will destroy some bone marrow cells to fill the bone marrow, and then the dogs will become, if the bone marrow collapsed, it cannot able to produce to renew our blood cells, and it's a life-threatening situation. So I just mentioned about the clinical side, the different phase of Eliquiosis from acute phase to subclinical phase on the most clinical or chronic phase. And when the situation are in the chronic phases, I think the treatment as well as the healthy management will become very complicated in that case. So we, again, I think early detection is very important. Early detection is very important. So it's about the we have a different kind of diagnostic methods. Again, history, physical findings is always important. Again, we have laboratory diagnostic tools to help us confirm our diagnosis. So we can use an antibody test. But if we want to use antibody test, we may need the antibody usually get higher and higher after 2 to 3 weeks after the infection. So it means we need sometimes to wait the antibody elevation. So the early infection, if the infection is within 1 week, we may not find any antibody increased here. So if we get the negative result, we may need to repeat the test 2 weeks ago, 2 weeks later, sorry. Okay, we also have ELISA and in interactive in fluorescent antibody test, and this test can help us to detect the organisms. Okay, and rarely in some cases, we can also observe the organism itself in the blood smear. We can take draw the blood and to do the blood smear. In rare cases, we can find the Eliquia in the monocyte. I think later we have a bigger picture to help us to see how Eliquia is look like in the blood smear. Okay. So basically, if you do some blood test, you can see the low platelet count. You can see anemia, and maybe sometimes you can find the high globulin because there is many antibody produced try to attack the Leaky. And currently, we also have PCR assay to directly detect a Leaky antigen, just like this. You can easily perform the PCR assay and to find if the any Leaky is present within the host. So here is the window. The x-axis is about the weeks post onset of symptoms, and the y-axis is the titer. So we can understand that the PCR assay basically can help us to detect the antigen in the first week. And if we use antibody assay to detect if any anti-Leaky antibody is within the host blood, you may take 3 weeks. You need 3 weeks, and we can find the proper antibody or IgG titer in the assay. So this is what we call that Leaky. They mainly live within the monocyte or PMN cells. So this, just like this, you can find Leaky is here in blood smear. So we have different kind of tools from the antibody detection assay, so PCR or blood smear, or ELISA or IFA to help us detect Eliquia. Okay, the third disease we want to introduce is also we call this Babesia, canine Babesia, and Babesia in dogs is basically there are 3 major Babesia to cause dog diseases, and is Babesia canis, Babesia vogeli, and Babesia gibsoni. And the first one, canis, as found in pelagic region, and it's mainly transmitted by this kind of tick. And Babesia vogeli is transmitted basically in brown leg tick, we just mentioned in the previous slide. And Babesia gibsoni is endemic in Asia, so also in Taiwan, also in Malaysia. So where it is transmitted by this kind of tick between the dogs. So this is 3 major Babesia that cause Babesiosis in dogs, and they are all tick-borne disease. So it's Babesia gibsoni and Babesia canis. Babesia gibsoni, the size of this Babesia is much smaller. So we can see this is a red blood cell. So it's Babesia gibsoni. They mainly live within in RBC, in erythrocyte. Okay, and this is Babesia vogeli and Babesia canis. They are bigger. The size of them are bigger comparing to Babesia gibsoni, and they also appear in two cells within the RBCs, or multiple, or more than 2. In some cases, there's 1, but the very giant, it is easy to tell the difference between Babesia gibsoni and Babesia canis because of the size. Okay, so this is the tick. I just mentioned that a different Babesia is transmitted by different kind of tick. Okay, it's the life cycle due to the time, and so we can I think we just take a round to see that when tick bite, it will carry the Babesia, and this is why we see the Babesia will try to do the binary fission. So that is why in Babesia gibsoni or Babesia vogeli, we can see the 2 to 4 daughter cells, but some cases maybe 1 because they didn't perform any binary fission. So we can find the daughter cell or the Babesia, only one Babesia on the RBC. So the clinical style of Babesia, the dog typically present with the acute and severe form of Babesiosis. So in the acute phase, we confound the abnormally dark urine and dog will with the high body temperature, weakness, pale mucus membrane, and depression and enlarged lymph node or spleen. And blood and urine test may reveal anemia, thrombocytopenia, hypoalbuminemia, and bilirubinuria. Okay, so this is described as the pale mucus membrane, but because actually in Babesia there are a lot of RBCs destroyed. So we can also find the yellow mucus membranes because there is a lot of bilirubin. So you can actually it's a hyperbilirubinemia. It means high concentration of bilirubin in the blood. So subsequently, you can find a lot of bilirubin in the urine. So pale mucus, this is yellow mucus. You can maybe one of them or both two of them. And sometimes there are neurological symptoms with seizures, meningitis, and this is what we call the abnormally dark urine because it's a hyper bilirubin urea. So we can see the enlarged spleen. So it's the usual symptoms we can find in babesiosis. So how to diagnose the babesia? Basically, in the past, we can confirm the babesia infection only by blood smear, but I think it depends on the progression of the disease and depends on the experience of the veterinarians or the technicians, because not everyone is good at observed these parasites only by blood smear. So actually, there is a very laboratory techniques such as fluorescent and antibody staining to detect the organism, or ELISA to detect the antigen or antibody. And just like Leukiosis, currently we have a routine PCR test to detect the Babesia antigen. So the PCR test has the advantage, and it is highly sensitivity to detect different species of Babesia. So we also have antibody test, but the antibody test, the issue of antibody test is once a dog has developed antibodies to Babesia, this antibody can persist for years, for many, many years. So if you got antibody positive, you cannot tell the difference. You cannot decide if the infection is ongoing or if the dog is just infected maybe 1 year ago or 2 years ago. So antibody test is only a supportive test. You need to perform antigen test to confirm if the case is right now under Babesia infection. So I think I'm sorry, I didn't, I just roughly introduced the 3 diseases. Actually, there are so many things we need to keep in mind about the heartworm infection, about the Ehrlichia, and about the Babesia. But I think the focus today is about the diagnosis. So just as I mentioned before, we have many, currently we're lucky because we have many techniques. We have many methods to help us to make us to jump the final diagnosis. And I think the commercial kits will help us a lot. Okay. So this is my brief lecture today, and thanks for your listening. Thank you. If you have any question or comments, you can contact me with the email later, or we have the discussion time later. Thank you.
You want to see that? Okay, before the Q&A, just a little bit introduction of NRVet, the partner of BioGuard in Malaysia. They offer our rapid test product. If the veterinarians in Malaysia want to purchase those rapid test kit or have any question regarding to this rapid test kit, you can directly contact NRVet. Okay, so let's go back to Dr. Lin for the Q&A.
Okay, so it's QA time.
Yes.
Okay.
And you can you click the 问答问语的 Q&A.
Yes, I see the questions.
Okay.
I see the questions and kindly provided by all the honored doctors. And I try to answer. If I didn't answer well, and maybe I can look up more information and response to the BioGuard company, and they can return to the audience here. Okay, so I think the first question I see here is about. Okay, I got a question. The question is about the heartworm microfilaria. If we perform the blood smear, is the blood smear sensitive enough to detect the microfilaria if the worm burden is low? I think it is a very good question. Actually, if we just draw if we just use a drop of blood and to do the blood smear, and then we can find microfilaria. Usually in this case, I think the dog is in very severe situation, and most of the time, we need to take maybe more than 1 hour and to see very carefully to see everywhere of the blood smear, and usually we cannot find the microfilaria directly. That's the frequent situation we faced. So that's what I said. We need some way to concentrate the microfilaria. We can use the centrifuge and we can use filter to help us to put the microfilaria together. This is the usual case we face. So I think blood smear, basically it's only by observed using the microscope, use our eyes. So it is not so sensitive if the worm burden is low. So yes, this is my answer. Yes. Okay, the second question I have is I received is the okay, because I mentioned that the heartworm antigen test kits available and in market. I think there is so many heartworm antigen test kits here right now in the markets, and it depends on the because this kind of antigen test is based on antibody antigen interaction. So we need to read the instruction first. And the antigen test kit I mentioned in my slide is designed for female heartworm test. So if you use this kind of antigen heartworm, you can only detect female heartworms. so not both sex. But I'm not sure. I think I need Dr. Lowe's help. How about the Heartworm antigen test kit in BioGuard? What is your design? Is for both sex or only for female?
Yeah, for biogas canine heartworm antigen test, we also detect the female adult heartworm and the secreted protein from the female adult heartworm. And by the way, I just another mention for the canine vet. For the vets in Malaysia, if you order the 4BX from the canine vet, the first 15 customers, they offer the special. They have a special offer for two plus one. For the first 15 customers order this 4BX. Thank you. Let's go back to Dr. Lee.
Okay, then I appreciate Dr. Long's help too. I hope I answer the question you have. So I think the main idea is you just need to read the manual very carefully when you want to use this kind of test. So it will help you to clarify the result you have. Okay, and another question is about how long usually will subclinical leukiosis last? Actually, it's a very I think it's a very annoying situation that about the subclinical infection of leukiosis, because once a leukemia they enter the host body, in acute phase we can see the very obvious symptoms. So we try to have some treatment, and currently we have the SOP to treat the acute leukiosis. And then I think most of them will be eliminated by the effective treatment. But there is always some very maybe smarter, some very bad Leaky. They enter the monocyte, they enter the PMN cells, and just a small size. Okay, very small size. And once they enter, they get into the cytoplasm of a monocyte or PMN cells. You cannot. They can last for a long time. They can last for a long time. So we don't know how long they will survive. They will last. It didn't mean that it does not mean this bacteria can live for a long time. I mean this bacteria can perform the limit or undetected proliferation to produce their babies without be detected by the host immunity, so they can survive. The Ehrlichia population can survive silently within the host, so that can last for a long time until one day the host immunity maybe become weak or become defective, and this Ehrlichia will appear again and will increase their population again to attack the host. So actually, I don't think I answered your question. That is because the Ehrlichia, they can survive well, they can hide them well within the host body. Okay, so next question is about if a dog with a highly suspicious Leukiosis, and however the infection is less than 2 weeks, and the test kits reveals negative. And I think the test kits maybe as for antibody, okay, because less than 2 weeks with negative result. Usually, I just mentioned that the antibody increase always needs to take 2 to 3 weeks. So at less than 2 weeks, usually you use antibody test, you cannot get positive result. That is normal. And and blood smear is also negative. I think that is also normal because you need to very carefully. You need to take a lot of time. You can only find maybe one Leaky present within the PMM cells. So if in this situation, we do blood smear, we do test kit, and they are all negative, but you just think, yes, it is so typical a Leaky infection based on the symptoms we found. So how can we do? I suggest because I think I mentioned in the slide is about that you can use PCR assay. PCR there is I think so many in Taiwan actually there is so many labs. Basically in my lab we performed the PCR assay, or in company they can provide a service for PCR to help the doctor to help the doctor detect a leaky, because PCR is designed to find the DNA of a leaky. So it is a very sensitive assay if we face this situation. I mean, highly suspicious Eliquiosis, but you use kit, you use blood smear, you find nothing. I suggest you can use PCR. Okay. Another question is how long the antibody of Eliquia can be stay in dog body after severe acute infections. Actually, the acute phase of antibody can last maybe within 1 month, and the basic class is IgM. But for IgG, I think it lasts for a long time, most of the time over 6 months to 1 year, you can find this antibody present. So if you to do antibody test, especially you use IgG, it can only tell you that the dog maybe the infection is undergoing, or maybe it is infected. So it can provide not so clear evidence for the doctor to diagnose the leaky if you perform antibody test. Okay. Okay. Question. I think currently in right now in the markets there are so many commercial products. So I think they have different advantages for each product. So to compare the sensitivity and the specificity of different products, I think it needs a lot of data. It needs a lot of data to say which one is better, which one is not so good. But it needs data to compare. So I think we have some kind of opportunity it will be great to do this kind of a comparison to help the doctor understand which one is better. Okay, I think because of time, so I thank you for so many questions, but because of the time limit, maybe I can answer the last question. Okay. This question is, if someone see microfilaria, but for the antigen test is negative, why should I suspect it? But I think because microfilaria is the is the obvious, very obvious that currently this case is infected by heartworm. So you need to right now, the thing we need to do right now is try to eliminate the microfilaria. So actually, I think you can say this case is heartworm infected, and the next step you need to do is try to eliminate the microfilaria within the dog body. Okay. I think I will answer the question here right now. And how about maybe I need Dr. Lo's help to save all the questions, and I can answer them I can answer them later.
Yes, of course, we are collecting the question.
Okay, thank you, Dr. Lo's help. And about and there's someone that we said we cannot see speakers. I don't know either why I can not open my camera. It's because of the moderator. Because the moderator said I cannot open the camera, Dr. Lo.
Really, I set up that.
Oh, it's okay. I think we can see somewhere. But it's okay. It's the end of the lecture, and I'm so happy to meet you all online. And I'm so happy that you have you give me so many questions. I think I try my best to answer, and I also learned your response. I learned your about the lecture, and I promise I will answer all the questions you give later. Thank you. Thank you again for your listening.